Welcome to Mastering Medicine Part 2. Over the past few weeks in Mastering Medicine Part 1, you learned a lot about the ABCs. Not the alphabet you are used to, but now we are talking about airway, breathing, and circulation. You also learned a lot about the brain, medications, and the endocrine system. The list is long. Maybe most importantly, you have started developing good habits of how you approach a scene, interact with a patient, and perform your assessment. I cannot emphasize how important it is to be consistent in assessing scene safety, being comfortable with assessing vital signs, and remembering the key parts of taking a patient history based on OPQRST and AMPL. Doing these things well and consistently puts you on the path to becoming an exceptional EMT. We will continue to emphasize and build on these foundational principles many times as you move through the course, but don't hesitate to go back and review them whenever you need to. In this course, you will learn a broad spectrum of information. There is a lot to medicine after the ABCs, after all. We will start out with one of the most important processes to recognize as an EMT that puts into practice all the skills you learned in Mastering Medicine Part 1. How to manage a patient that is in shock or cardiac arrest. Not sure what that exactly means? That's okay. We have a whole module coming up to teach you. Additionally, you will learn about some really relevant topics for those of you that are outdoors people. Topics such as hypothermia, hyperthermia, lightning injuries, and altitude sickness. Here in Colorado, where lots of people go into the mountains to hike and ski, these topics can be pretty important to be familiar with. Before we wrap up medicine, you will also learn about one of the most common situations we come across in our system, and that is substance abuse and behavioral emergencies. These aren't always fun to deal with, but it is really important to learn about. Hopefully, looking ahead at all of this doesn't make your stomach hurt. But if it does, don't worry. We will cover that at the very end. You have made it so far already, and the solid foundation you have developed over the past 2 courses will really help you as you press on through Course 3. I know you're up for the challenge. As we have mentioned before, there's a lot of information in these videos, and mastery doesn't come with simply watching them and doing the questions. All of these things take study, repetition, and practice, so don't be afraid to slow down, revisit things in the videos that don't make sense, and go back to other courses to review topics you might have forgotten. Also, be sure to check out the course resources that are provided. We want to help equip you to take the best care possible of your future patients. Finally, don't forget about all the other learners out there that are going through this process with you. There is a huge amount of insight and wisdom that you can gain from each other. So settle in and let's press on and master the rest of medicine.